Thanks, Katie. Good afternoon, everyone. Welcome to the January meeting of the Community Engagement and Communications Committee of the Universal Health Plan Governance Board. Say that 10 times fast. I'm Michelle Glass, one of your co-chairs, along with Amy Fellows. I use she, her pronouns. And I am looking forward to starting a whole new year of this important work with all of you. So I'm going to pass it to Katie for a quick tech check.
Thank you. All right, so just a reminder to everyone to please make sure we do have Spanish interpretation available, so please make sure you choose the English channel during the meeting. Also, if you are able to keep your camera on, if possible. I mean, granted, there's times when you're not going to be able to, like myself today, and that's okay. And then just make sure you stay muted when you're not talking and raise your hand, use the raise your hand function when it is time for your comments. And that is all for tech check. I'm going to go right into roll call. But first, let me just see if I've got anybody in the waiting room. 1 moment. Okay, starting with Amy Fellows.
Here.
Colin Stackhouse.
Present.
Craig Newton.
Here.
Grace Hokog.
Present.
Jay Brown. Jensina Hawkins.
Here.
John Buzzard.
Here.
Jocelyn Ogden.
Here.
Juan Pablo. Max Brown.
Here.
Michelle Glass.
Here.
Mickey Durding. And Yesenia Hernandez.
Present.
Thank you. All right, I will pass it back over to co-chairs.
Thanks so much, Katie. So to go over our agenda for today, it's up on the screen. We just did welcome, tech check, roll call, and we're doing agenda review right now. We have a debrief of a Universal Health Plan Governance Board discussion that happened earlier this month. Some of you were maybe there. So we'll report out from that and hear from y'all if you were able to watch or attend and have a feedback discussion on what the board had to say about our community engagement contract with Diana and where we're at in our work plan right now. Then we have a follow-up on a suggestion from all of you. So thank you so much. At a meeting, I think last November, this committee recommended that we create an instruction guide in English and Spanish that was plain language and easy to follow for people who might want to provide public comment to the board or any of its subcommittees like this one or any of the others. So Jenny has a draft of that for us. So thank you, staff. We'll go over that today. And then Amy is going to bring back a conversation that we checked in with the full board, the Universal Health Plan Governance Board, about board meeting travel as a potential opportunity for community engagement across the state. So bringing that back to you all for thoughts and input. And then staff is also bringing an update on the engagement resource list that we've been working on co-compiling. I know you all have been sending excellent suggestions, so thank you. There's a new streamlined way to add to that now, so we'll hear about that. Then we'll turn it over to all of you to hear any updates you have that is relevant to our work. So any engagement opportunities or things of that nature. And then we will reflect together on this meeting and brainstorm any future topics, and we'll hear from the public. So that is what we're going to do today. Any questions about the agenda? Hearing none, we'll move into debriefing the board discussion and feedback. So I know I saw some of you there, I think. So looking forward to hearing your thoughts. But briefly, just to kind of level set, what we brought to the board was an update on where the Community Engagement and Communications Committee is at in our work plan. And the questions that Diana from Artemis Consulting brought to all of you in December, we brought those same questions to the board to provide any additional input or thoughts on that phase of targeted community engagement before we initiated that work. So the feedback that we received is that in terms of timeline, we got some really helpful updates from the Plan Design and Operations Committee that they will not have a draft plan for us to take out for public engagement until probably around June. So that was helpful to understand where they're at in their workflow. They have several months of groundwork to lay before they have something that we could take out as a draft to say, what do folks think about this? So this will free us up as a committee. We have two separate work streams, community engagement and communications. So I'm actually really excited about this, this timeline update because it allows us the time that we need to start our communications work. And that's important to have our strategic framing, a communications consultant, and some core ways that we all agree to recommend to the board in terms of how do we talk about this, right? We don't want to create harm or confusion when we take a draft plan out to the committee or out to the community. And as I'm sure you all know, there are many ways that we could talk about the same draft plan that could elicit different responses. So we want to be as thoughtful and careful as possible when we actually start our community engagement work. So we checked in with Diana, and Diana suggested that we pause her contract until it gets closer to that June timeline when we'll be ready to go out and do that engagement. So we've done, basically since we started meeting, we've done a lot of prep work for that community engagement. And now we can pivot to communications, do that prep work so that when we go out to do that community engagement work, we will have everything in place to be as careful and thoughtful and set up for success as possible and not do any harm or cause any confusion. So we would like to bring in presenters in the next few months to this committee who will focus on healthcare communication and help to give us direction on how best to frame this discussion right now, right? We know that there are some ways that we can talk about the exact same thing that resonate really well and other ways that maybe are really loaded for people or have negative connotations or that could be confusing. So we want to bring in some of those folks with the intent that we want to set the board up with all the tools and have some framing suggested for them. And we don't want to undermine this effort before it can really take off. So are there any suggestions that you all might have, recommendations for presenters or communications topics that you think would be really helpful as we as a committee focus on coming up with some of that framing and some of those talking points to recommend to both the board itself and also to bring to our community engagement consultant, Diana, and any other consultants that we work with when we start to go out and do that engagement. We also, I did see one hand, but I just want to make a quick note that I know that you all are here because you care so much about this work and you're all action-oriented folks. I have the same orientation. And so, I know that it can be difficult when the timeline changes abruptly, right? So we didn't know until January, until this last week, that there wasn't going to be a draft plan ready to take out for engagement until June. So we really appreciate your best thinking on this communications piece as another foundational piece of work. And just know that the board, it was really clear from the discussion, the board is really leaning heavily on this committee to do this prep work, to do this thoughtful groundwork, to bring them recommendations. None of the rest of the board or other committees are focused on how to frame this work, how to talk about this work, or how to engage in a strategic way. So I'm really grateful for all of your help to set us up for success and also to make sure that we don't do any harm when we go out to engage with the public about these proposals. So would love to open it up now to see if there are other folks who attended the board meeting or watched the recording that have other thoughts or reflections, or to see if you have suggestions of presenters or topics that you would like to hear from as we pivot to this communications work stream that's in our work plan. Colin.
Yeah, hi. I attended the board meeting. Congrats, Jennifer, on this new big role. That's exciting. I think as far as suggestions for speakers that could potentially come, I'm referring back to the Healthcare for All Oregon annual meeting. We really have one in-person meeting. And last year there were two speakers. I didn't go in person, but I listened afterwards. Amory Vogel and Patty Wentz. I spoke briefly with Patty Wentz from Jackson Consulting last month, and she's really dialed in and intelligent. And the presentation at that in-person meeting was all about the ways in which to communicate about this. And so, and Amory, I forget which organization she's with, but she had a lot of really good data about saying the phrase single payer versus universal healthcare and that kind of nuance. So.
Go ahead, Amy.
Yeah, Colin, you thought of the exact same thing that I did. I think I may have shared the recording of the two of them, and the other woman was from a polling agency. So, like, one of the things that sticks out is she shared with us at that June event that single payer does not poll well, right? So, I mean, that's like an important thing for us to know. We're not using that language anyway, but like, those are the kinds of things that we really want to be aware of when we are creating messaging around this. So I could ask staff to send the recording out again, but I think it would also be good. And we already had kind of Patty on a list of people that we want to reach out to as well.
The recording on YouTube is like very cumbersome, so I think an in-person
not the best.
presentation, yeah,
Okay.
in person would be better. But yeah,
Okay.
I watched the recording and it was a bit of a chore, but the content was really good. So we will work to, thank you, Colin, for bringing this forward. Thanks, Amy, for sharing that recording with the board. We'll work on seeing if we can get those folks lined up. I think that would be excellent. Appreciate that. And for folks who don't know, the Universal Health Plan Governance Board, thanks, Colin, for bringing that up. Universal Health Plan Governance Board Executive Director Morgan Cowling got another new opportunity that was too good to not pass up. So she is departing the board, and Jenny, who you all know from these meetings, is going to be the interim executive director. So that's what that congratulations was about. So Jennifer Donovan becomes the acting executive director, I think the 24th, if I'm not mistaken. So yes, I share in Colin's sentiment to congratulating Jenny and thanking her for her leadership.
Yes.
Oh,
I was just going to say the job description for the executive director just came out today. So I don't know, staff, if you're planning to send that to all the committees or what, but it seems like we would want committees to share that in their networks as well.
Yes, we will definitely be sending that to all committee members.
excellent. Thanks, Amy. So one other thing that the board requested that this committee work on is really doing thoughtful work about how we frame specific questions to give Diana some real concrete and thoughtful questions that she can bring to the targeted list that the Senate Bill 1089 mandates that we engage with. The board provided some feedback that they have seen other engagement that was done very open-endedly, just like kind of like, well, what do you think? Here's a plan. What are your thoughts? And that did not result in always the most helpful feedback, or even feedback that reflected a really nuanced understanding of what was being proposed. So the board would like this committee to bring the board and then also the consultants some language for what kinds of questions specifically we want to ask employers, and we want to ask healthcare providers, and we want to ask all of the groups that are on that list. And so I think when you're thinking about what kinds of presenters or content would be helpful for you when we start that work of drafting questions, that might help a little bit. So I think that, somebody coming in and talking about, here's what polls well, here's what doesn't poll well. So we can frame questions in a way that doesn't like make people initially you know, have a reaction that isn't helpful. So that's a you know, one way to think about it. Are there other suggestions? Yes, Mickey.
Hi there. I was wondering, I think what would help me to draft questions for consideration is if I could kind of get a sense of what does it look like step by step from the very beginning? Is it that we're okay, we have this plan and now we're going to be reaching out to people, or have we been reaching out to people up to that point that we have a plan? Is it, hey, heads up, there's a plan in development. Please, come along with us. Here's the board meetings. And then once the plan is completed, we then send it to them and go, here's the plan. If you'd like a presentation about it, come join us. Do you want us to come to you? Do you want to come to us? And then after they actually digest the plan, then ask them the questions, the prompting questions for feedback. I would like to, that would help me in crafting questions if I could see what does it look like? What does the journey look like leading up to the questionnaires that they're going to be getting?
That's a great point, Mickey. And I think we can take the scope of work. The board has a work plan and a timeline, and Diana has a scope of work. I think we can combine all those things and bring back a really helpful visual, perhaps, at the next meeting, in addition to some of these other topics. But I think just to respond immediately, like right now, I think all of us are encouraging the people that we're talking with to tune into board meetings, to sign up for updates, to give public testimony if they have any thoughts to share. And we are seeing increased engagement. And I know a lot of folks in this meeting have been doing that work. So thank you. So that can, is happening informally. The legislature didn't necessarily give us the resources to go out and do that on a large scale. So what the legislature gave us resources for is once there is a draft plan from the Operations and Plan Design Committee, and once there's a plan for how to fund that universal health plan from the Finance and Revenue Committee, the legislature has given us some limited monies to take those draft plans and not necessarily say, like, if you'd like a presentation, let us know, but to do directed, targeted outreach to specific populations that they felt were missed when the task force did its engagement. So there was a task force before the board and it did a bunch of engagement, and there's a task force report that I think staff has sent out. And a lot of that engagement was focused on BIPOC communities, rural communities, folks who've been left out of a lot of policy conversations in the past. But the folks who engaged less with the task force were the folks that are now on the list that the legislature said, okay, here are the folks we didn't hear from. We want you to make sure that you do targeted engagement with these limited resources with this list of folks. So we can bring that back in a summary, but that's kind of the quick answer to kind of the gist of your question. Is that helpful?
Yes, and then also, it would be great, and I know we don't have a lot of money right now. I think at some point we were talking about that maybe we could actually do free outreach ourselves and have some sort of consistent messaging through talking points. But I was wondering if we could maybe even have like template letters that we send out to these distribution lists if we hadn't already, that because I'll be in meetings and they'll be like, oh, we're doing that. I didn't know about that. And I'd be like, yeah, but then I kind of hold back on saying anything yet because I want to be consistent and have talking points and all that. But it would be great to see like what was sent out already, the letter. And you'll have to forgive me. And I know I've read through all the documents, but sometimes I have to do it more often than just once to really digest it. But it would be great to like, okay, we sent this out on this date. Here's the content. Here's the response. And I get you had that list of groups that were missing, and what are we going to be sending to them? And like all this information, I might just be an information junkie, will help me with proposing some questions.
Yeah, that makes sense. And to be clear, we won't necessarily be sending information. Diana will be doing targeted outreach to pull together groups of folks to do a live conversation with, to say, here's what's being proposed. Here are some questions we have for you. And also, what did we not ask you about that you have to share? But it'll be like a dialogue, not necessarily just like, if anyone signs up for the Universal Health Plan Governance Board updates, they get meeting updates and agendas and notes and things like that. But this will be much less a passive, like, here's a bunch of information, people, and more of a, like, we invite you to have a conversation and engage in a dialogue with us and share your feedback. And that's why the limited resources is an issue. If we were just sending out passive information, that doesn't really have a big price tag, right? But we also don't get a lot of engagement usually when that's the case. So that's more the intention. And in terms of your other point, we have committee members who have already done their own outside of the official work of this committee and the board. Like, I won't name drop anyone, but later under updates, folks may share who have gone out and done engagement. And the board does have talking points that we can supply you with. So we're happy to share those with anyone on the committee who wants to do engagement. We just ask that you make it clear that you're not officially representing the position of the board, that you're sharing from your own perspective and you're engaged in this work. And here's where we're at, and you can do that engagement anytime, of course. And we're also just one piece of this big statewide body of work. So we know that Healthcare for All Oregon, the Regional Health Equity Coalitions, and other groups across the state have been talking with communities about this proposal for a long time and are continuing that work. So this is not the be all end all. This is just what the legislature asked us to do. And so hopefully that helps. If you need any additional support or resources in there's engagement that you want to do, we're here to support you.
Great. Thank you.
Thanks. Let's see, how are we doing on time? Any other suggestions on speakers? Otherwise, we can add to this speakers list at any point, but we have two names to try and line up for y'all to start with, and also this request about a timeline and more of what the process might look like to bring back. Anything else? All right. Thank you. And thanks to those who came to the board meeting. It was great to have you there. I will pass it on to Jenny for the public comment instruction draft.
Thanks, Michelle. Hello, everyone, and thank you, Colin, Amy, and Michelle for the congratulations. It will be interim, and we are, as Katie said, we've already sent out the job announcement. So please, as we share it with you, share it wide. We want to get a really great candidate pool for our new executive director. So on to the public comment instruction draft. So we talked about this a few meetings ago about wanting to put together an instruction draft. I was hopeful that we would do some website updates before we started talking about this, but I think internally to the department and actually statewide with the agencies, there's some transitions going on in the state websites, and so we can't make changes right now. But to preface this document, I did want to say that there are going to be some changes made to the Universal Health Plan Governance Board website. And so public comment is now going to be an option in the top ribbon for the landing page for the Universal Health Plan site. It's already at the bottom. There's a box at the bottom where you can click to go to the public comment submission form. But we're going to add that to the top ribbon too, so you see it when you hit the landing page, or if you've scrolled down to the bottom, you have the option there too. So sort of the no wrong door policy of making sure that people know that they can provide public comment from the point they land on the page. But that's going to be an update that we're going to see probably in, I think, a month or so, while the state system goes through a migration and we can't make changes right now. In addition to that change, we're also going to be updating some of the language on the public comment page. So Katie, if you could go to the next slide. Oh, I forgot that I did this. And so as we go through those text edits, you can go to the next slide, Katie. We're also going to be making some changes to how the site is structured in terms of drop-down menus and the things that are required and aren't required. I'll talk a little bit about that as I go through these screenshots of the document to let you know where we're thinking about making those changes. Also, I'd be happy to hear from any committee members, either as we go through the document or later on, because we have some time before we're going to be able to make those content changes and the text changes. Any recommendations you have about if you think the language in this document or on our website is cumbersome or not plain language or hard to read or hard to understand, please provide that feedback so that we can integrate that when we do make those text edits. So looking at the instruction draft itself, like I said, you got the full document, but then I did some screenshots so that we could go over it in this meeting so that I could get some feedback and see how you all are feeling, if this is the kind of document you are hoping for, and if there are any changes you'd like to see in the instruction draft. So we start off with a little bit of an overview of how encouraged we would like to have the public to provide public comment to the board. And then looking at the website and giving just a step-by-step instruction of what they need to fill out. And so you can see what I've showed on this slide where it's at, where the little yellow arrow is for submit public comment. That's at the bottom of the current UHPGB landing page. So having it up there at the top ribbon is going to be, I think, a little bit better, since right now you have to get all the way to the bottom before you can understand that you can submit public comment right there from that page. You can go to the next one. So on the public comment page, it's important that for the instructions, we want to make sure that people understand what the time frame is going to be. And for public comments, for committees or for the board, oral comments have to be, for oral comments, the form has to be submitted as well. You can't just show up to one of the online meetings, show up online to do submit public comment. You have to register in advance. Now, as the note below it says, that isn't true for the in-person board meetings. When you walk into the board meeting in person, there's a sign-up sheet where you can sign up during the meeting to submit public comment. And so we want to make sure that we're really clarifying that for people. And only the board meetings at this point, the full board meetings, have in-person meetings. So it would only be applicable to those meetings. And then for written testimony, we require no later than 72 hours. That is so there's a posting time, and so that committee members or board members have an opportunity to review public comment before the committee meeting. So we want to make sure that everybody has an opportunity to actually engage with that public comment. And that's important because we don't want public submitting public comment, 5 minutes before the meeting and no one being able to see it before they actually go into that meeting to talk about the issues for that day that someone submitted public comment on, because that doesn't really honor the process of submitting public comment. So we want to put it out there and make the public aware that there are timeline requirements for when you have to submit the form. On the website, I will also say, I put those underlines on the instruction draft. They're not called out specifically that way and underlined in the website. So that's something we might want to consider. Do we want to highlight that in a different way? Next slide, Katie. So filling out the form itself. So if you've been to the website and you've looked at the public comment form, it's one page, and then there's a whole list of where the person who wants to submit comment has to fill in the information. Right now, all of this information is required. In the edit, the organization says if applicable, but right now it's a required field. That will no longer be a required field. Looking back, we're looking at this and we're saying if it's not applicable to someone, they shouldn't have to put something there in order to move on. But then general information, their name, their email address, the date, and the topic. And so some people can be uncomfortable sometimes with submitting personal information aside from their name. Your email address, the email address is really important here, because once they've submitted their comment, particularly for individuals who want to also submit oral comments, they're going to need to provide that email address so that we can send information to them on registering for the meeting if they're going to do it online, showing up in person if they actually want to come to the building and provide public comment. Where are they going? What's the location? Is there parking information? And that's something that I'm planning to put together a tips document for public comment as well, that'll follow up in our next meeting, so that it has things like where's the best place to park to go to the Labor and Industry Building where the board holds their meetings, to give additional information. And so making sure that within this document, we're letting them know not just how to do it, but why we're collecting some of the information to try to make them comfortable. Next slide. And so again, there is a drop-down menu here. Oh, I'm sorry. There is the which body are you providing comment for? So this is obviously very important so that we know where to route public comments, and ensuring that they choose so that we know where it's going and that the right committee or the board gets it at the right time. Their phone number, that's optional. They don't have to provide a phone number. Written, and the language here also I want to point out. So here right now it says, are written comments submitted with this form? And then do you plan to offer oral comment in addition to the written submission? And so that kind of, I think, is a little bit difficult to understand and kind of makes it unclear if you can do just one or the other. So I've tried to make that clear in the instructions, and also put in here the language that we'll see on the website, which is just going to be, if you only want to provide comment, do you want to provide oral comments at a meeting? Do you want to provide written comments for a meeting? To make it very clear to them, if you want to do this, click yes. If you want to do this, click yes. And so there's not like an and or kind of thing on the sheet or on the submission form, to make it as clear as possible so they can choose to do one, they can choose to do the other, or they can choose to do both. Next slide. And then here we have the checkbox that's on the form, and that's for meetings where the board or committee is going to take a vote. And it's been announced on the agenda that the board or committee will be taking a vote. When we have agenda items where the board or committee will be taking a vote, we want to give the public an opportunity to comment before that vote is taken. Usually in meetings, we see public comment at the very end. If there was an agenda item where there was going to be a vote and we left that at the end, that person who wanted to give comment about that particular item wouldn't have an opportunity to do it and provide their insight and input before the vote was taken. So we ask that if there is an agenda item with a vote, you click this box to ensure that you can be called upon to provide testimony before that vote is taken. And again, here, I've written out some language. I would love any feedback anyone has to ensure that it's very clear why you would check this box and when you would check this box. And for the next section, we have please share your affiliation. Again, sometimes people are hesitant when they're dealing with government sites to provide a lot of information. And so I wanted to share here, the reason that we collect this information is for board use. It's so the board knows who they're engaging, board or committee, who they're engaging with in terms of where that person identifies themselves within the healthcare community. How do they self-identify in terms of where they sit in that community? And that's where their content, that's the context for where they're coming from when they're providing their public comment. Next slide. And then for individuals who are submitting public comment, we want to make sure that they fully understand how they could submit. I know that sometimes people are not familiar with technology or uncomfortable with it, and sometimes submission of forms can make people a little bit uncomfortable. So wanted to provide some instruction here and step-by-step guidance on how you get on your own computer to the file that you want to submit for public comment. And so again, looking for any feedback here on the language or whether or not these instructions are clear. And so that's the end of the document for public comment instruction. And I would love any feedback from the committee on improvements that can be made, changes, both to the document or to website language that you would be interested in seeing. Colin.
Yeah, I'm really glad that in this new submission option, they'll be listing the different committees and also the governance board. I think having that easy is obviously a better choice. I'm wondering if there's like a way, I bet there's people who want to submit public comment who aren't familiar with the work that we're doing. And so like a diagram or some way to describe in the form that there are 4 subcommittees, and so like the main board is the board and the committees are super clear that they're a subset.
Thank you, Colin. That's great feedback. Amy, go ahead.
Yeah, when I saw that same section, I wondered, and we may or may not want this, but if people can only select one, or if they wanted to share feedback with more than one group.
I don't actually know the answer to that, Amy, but that's a great question and we can test it out. Do you think the preference should be that they could select as many as they wanted?
Yeah, but then I was thinking, is there something in the background that makes that more complicated? I'm not sure, but yeah,
Automated?
Yeah, I just wasn't sure exactly what it feeds.
It feeds Katie.
It feeds Katie. Okay. So I guess it's a
So right now
staffing.
there's someone that looks at all of these. There's no automated system that takes this information in. So
Okay,
we would
yeah.
disaggregate that.
Okay. I see
John,
John.
This might be a series of questions that sort of branch off from the question or the suggestion that Colin had. But first of all, let me just set the stage for what I'm about to share and say. I think I was only kind of I had a general idea of what kind of public comment meant in our prior meetings and conversations on this topic. And so to see the form, you really kind of take a look at the form today and before coming into the meeting today. I guess I just had a question about sort of the kind of the prefatory information at the top of the form where it talks about for oral comments, do this, for general written testimony, do that. When I had this idea of someone being able to, a citizen coming in off the street or hearing about this, this board or this initiative coming in off the street. So suddenly I'm sort of being asked to sort of think about a decision tree, whether what I'm about to share is oral or written testimony or what it is relative to an upcoming meeting. I have that context, right, that Colin was suggesting, which is maybe the citizens' understanding is of this structure of all the activities and all the people involved with it isn't quite so granular as ours. So I just thought, I'm just going to throw this out there as an example is, so do I have to fill out this form if I intend to join any one of the upcoming public meetings and share some sort of a feedback at that meeting? Do I have to fill out this form before I do that?
Yes. So unless you are in person at an in-person meeting, which at this point only the board holds, no committees hold in-person meetings. That's the only opportunity that someone would have to say, walk in off the street, sign up, and then provide comment at the end of the meeting. In order for us to take public comment for an online meeting, we have to have prior notice through the form.
And so just kind of surfing or going through the website a little bit to look at future meetings, can't the public signs up for an online meeting through the Zoom form, right? Is that right? So I'm just wondering, rather than to kind of like reduce friction for the citizen, would it be possible to integrate somehow some sort of specific set of questions for the online attendee in sort of that registration or that interaction to sign up for Zoom? Do you know what I'm saying? Like, it seems like a lot of friction to hop around between, wait, I've got to go here to Zoom, and now wait, oh, I can't actually speak there if I'm inclined to speak. Now I have to jump over to this other place and do this other form. Like, it just seems like a lot of jumping around and I just, I can just imagine some citizens that are motivated and interested that might find that cumbersome. So I'm just kind of like, sorry for my speaking of plain language, I'm kind of just using plain language here and just saying that seems like very clunky.
I think that's great feedback. I am not 100% sure because that's auto generated by Zoom. And I'm not sure what our role getting all of that information back out to the person registering, but I think it's a great idea and something that we can look at and see if there's a mechanism for us to do that.
Yeah, and that mechanism may not be, you're right, like off the top of my head, I can't remember like the functionality of, I don't think Zoom, registrations extend to sort of adding custom fields. I might be wrong about that, but I don't think so. But for example, that workflow for the team who's intaking those Zoom registrations could possibly automate some sort of a follow-up to those attendees who register, which would signal at least like they're halfway there to providing public comment because they're signaling an interest to attend, is have a workflow that reaches out to that person that says, "Dear Jennifer, thank you for registering via Zoom. We look forward to seeing you on such and such a date. Please note that if you want to provide public comment, there's one more step you need to take. You have to actually go here and fill out this form." And presumably that might be a more tailored form because then they don't have to make all these choices that are presented here. It can be much more focused. I know that you were attending that meeting on this date. Therefore, I don't know, there's probably a 50-50 chance that you might want to actually say something at that meeting. So yeah, so that's the part that really kind of like and then again, some of the not the instruction in your instruction form, but I'm just commenting here on the actual comment form itself, is just kind of that staging about 72 hours before the meeting. I would bet you guys anything that more than half the people that come upon this form or may learn on this form and come in it with like the mindset that I've heard about what this group is doing. I'm not fully educated. I'm not familiar with all the meeting schedules. I just want to get this off my chest. It's very important. I have a group to speak on behalf of. You know, I'm a nurse and I work in a community hospital. I have a big concern I want to share, and so I'm rushing here to do this. And so suddenly I'm being asked to navigate committee schedules and things like that have nothing to do with my day-to-day life. So that part just makes me gives me pause. It seems like it's adding hurdles. So I'm just throwing that. I don't have a specific solution in mind, but and then so which UHPG body, that specific, going back to that specific question that Colin raised the question about, I may not even know that the committee structure. I may not need to be versed in the committee structure. I mean, I don't know. I'm just thinking about trying to be user-centric and citizen, public-centric here and say, is there a way to frame that makes the person less feel like dumb if they don't know about all the operations of the various committees, and asks like sort of more generally like, what topic does this best apply to? Financing of a universal health plan, plan like some sort of something going back to what Colin was saying about something explanatory that puts the comment in a context. It doesn't necessarily have to be framed in terms of how we structure this initiative. That's not to make it opaque or anything. It's just to sort of phrase it in a more approachable fashion. And then the other thing, again, speaking of sort of what I see as personally as kind of hurdles to usability, is, are you submitting written comments with this form? I think I understand why you guys, or why the tendency is to ask someone to upload something so it can be like shared like a PDF or something. But that to me feels like another hurdle. If I'm doing this on my phone on my lunch break somewhere, right? I'm on my phone in the parking lot of Taco Bell, and just to take a random example, I'm not likely to have like a Word document sitting around on my phone to like upload. Like, can you just give me a text field? And then the burden is on the agency, is on the organization to sort of transfer that into a format you can share with the committee members, rather than putting the burden on the citizen to sort of have like all their technology ducks in a row. Make it super easy. And like, then de facto, you don't have to ask, our written comments was submitted with the form. Did they fill out the field for comment, or did they not? And then you just know, right? So yeah, and then so again, so a lot of to me, what looks like there's just a lot of text, which is also kind of a point of friction. Check this box if you'd like to provide oral testimony related to a specific vote, and you'll have the opportunity to share. Anyway, there's just some of that stuff that could be, if you kind of deal with that through the registration process for the meetings, you can kind of really streamline this form to the point where it's really inviting and approachable, and you don't feel like you're passing a knowledge check quiz in order to be a participant in this process. So sorry, that was a lot. I think I've said more in that one comment than I've said the entire time through all of our meetings. Sorry about that, Jennifer.
I appreciate it very much.
Thanks, John.
Jen,
I do want to note just real quick sorry, Jenna, before you move on to the other hands, just for anyone, and I know this is not what you meant, John, at all, but I want to be really clear that for the Universal Health Plan Governance Board, as is the case for the Oregon State Legislature and any city council or any other public body in the state of Oregon, you do not need to have any specific citizenship status to give public comment. Any resident of the state is welcome to give public comment, and it is all considered And so like I said, I know that's not what you meant, John, but I think for some folks, when you hear that word citizen, it has a very
Yeah,
specific.
I'm sorry. Yeah, member of the public.
meaning.
Sorry. Yeah, sorry. I didn't
I
mean
just wanted to be
be
clear.
exclusionary or anything like that.
I know.
And then to that point, or sorry, Michelle, just one quick question I meant to ask for you or Jennifer too is, with the fields that you're asking of members of the public who submit this form or interact with this form, do you have any interest in whether or not they're based in Oregon or not? Does that matter to the legislature? That was another question I had. Sorry, and I'll stop now.
We don't collect that data, or I mean, I don't even want to kind of call it data because we don't really treat this as data, but we don't collect that information. I don't think that it's ever been discussed in terms of whether or not it matters if someone is from the state when they're submitting public comment. We could add a field where we ask for, you know, the state that you live in, just for information purposes. I'd love to hear anybody else's thoughts on that as well. And Jensina, please go ahead.
Thank you. I just wanted to say that I echo John's thoughts regarding the complexity. It's hard enough for me as a committee member just figuring out how to get registered for the Zoom and then actually finding the link to get into the Zoom at the meeting time. And I have a seat at the table that's saved at the table for me. So I really, really cannot echo, I cannot emphasize enough John's comments.
I'm interested, Colin, I see your hand. I just want to ask one question. So I'm interested, since sort of the whole world has gone online to some degree in terms of having more public meetings and having more meetings online, I'm interested if anyone is aware of a platform or a tool that they've seen used that allows more specification when you're doing that type of registration, where you could maybe make it more personalized to the work that you're doing, where you would have the options to add some of the features that we're talking about here. Currently, in terms of how we host the meetings, we host them through Zoom. Zoom generates the link, Zoom generates the emails. And then in terms of how we're taking in public comment, right now it's very staff centric. It's very, very much a labor that staff has to take on to pull in the public comment and pull out all the information. And so if anybody has any ideas or awareness of any tools that could be used for this, I'd be really interested in knowing more about that. It's certainly something we can look into and try to do some research on, but if anybody has recommendations, I would love to hear them. Colin, go ahead.
Yeah, two more ideas. No ideas about like a better, I don't even know how to answer that. The question you just asked about like a better platform than Zoom or like some way to streamline it. I don't know. At the risk of just like suggesting adding even more text and like more explainers to this public comment like form and idea, like we could maybe think about adding a sentence that's like, are you confused? Are you not sure who to talk to? The governance board would then be the best choice, you know. But if you know that your idea or your suggestion should be in operations or finance, go for it. But if you aren't quite sure what to do, just talk to the board. So that's like one idea. I don't know how the best way to like implement that. And the other brand new topic about knowing people that are submitting comments, whether they live in Oregon, I think that's pretty important. I think there's a chance like this work will take some precedent or like we'll get a lot of national attention. And if we're changing how we work in our state based on the opinions of people that don't live here, that's a waste of time and stupid. So, yeah.
Amy?
In terms of the residency, I don't know, do people think it should just be like, do you live in Oregon, yes, no, or a field for zip code, but then that's getting more personal information, but it would also give us information about if the people engaging live in rural communities or urban, you know, those kind of things.
Sorry to jump in, how do we make sure people aren't lying? You know, people can lie on a form, say they live in Oregon. There's no way to check that, but just another idea. Thanks.
Yeah, there's no way to, I mean, there is no way to check that. That's not really intrusive and not something we would do. I will just say, just to throw it out there, that it is the intention of the board to engage with some employers that we have a lot of people who live in Oregon who work for companies that are not based in Oregon. And there's a big complicated question about if we say that your health insurance is no longer tied to your employment status, what does that mean for employers that employ people in Oregon and other states? That's really complicated. We actually do need to talk to those employers about how to make that work. So I think asking a question about residency is great and it'd be good to know, but I just want to make it clear that there are cases in which the board intends to talk to people who don't live necessarily in Oregon for specific reasons. So just for your information.
Max, go ahead.
Yeah, just had a comment for affiliation. If there's some openness for some more affiliations, I'd recommend putting in someone in the system who could be like a direct care worker or a professional, if they identify, maybe also kind of like a provider, which would kind of the connotation of like a management within the health system or a hospital affiliation with that. So the direct care worker, and then the kind of the administrative part of that. Another would be maybe just general member of the public. And then if there's a possibility for somebody to fill out a box for another affiliation where they want to identify something more specific in addition to refusing to identify with any affiliation, that would be great too.
Thanks, Max. Okay, this was really, really great feedback. I appreciate all the comments on this. What I will do is I will take an opportunity, see if I can change a little bit of the drafting, make some recommendations in a draft of what we'd like to see when we do make website changes, and then maybe have a conversation internally, because our website is hosted by DCBS. So have that conversation internally about what the functioning and capabilities are, or what they might be. Because like I said, the system's going through some sort of new platform integration. And maybe bring this back in the draft form in the next meeting to sort of capture what everyone thinks is things that we would like to see. And then maybe once we have the opportunity to look at the website upgrades that we can make, bring that back to talk about what we can actually do within the platform that we work in. Craig, go ahead.
Hey, thank you. I've been listening intently. Maybe I missed this. Concerning questions from the public or anybody, is there a place on the public comment where they can just type in their questions, or must they submit them via PDF form or whatever? Thank you.
There's only the option for submitting information via PDF. There is the link for the UHPGB info email. So if someone wanted to click it and just say, I just have this question, that does happen. Sometimes we get emails that say like, this isn't public comment, this is a question. And depending on where they get the email, it's throughout the site. So depending on where they're actually clicking through that email, it may be that they did so from the public comment page and then are just wanting to ask a question instead. But in terms of submitting public comment, they would have to do, right now, they would have to do so through the upload. Amy, go ahead.
I think we really need to look into that. I think that's a barrier for people who only have smartphones. And I'm pretty sure that the OLIS system allows you, I'd have to, it's been a year, but I'm pretty sure that the government OLIS system allows you to do public comment without, I'm sorry, the Oregon Legislative Information System. So if you're giving public comment on legislation, I'm pretty sure you don't have to upload a PDF.
I can look into that. And just to note, so the Oregon legislative system and the Oregon agency system, when I'm talking about the agency
are different. Of
are
course.
different, but it's definitely something. I'm very familiar with OLIS, so I can look at OLIS and see if that's an option there, and then maybe reach out and see how they facilitated that to see if it's something we could do.
Yeah, I haven't looked in a while, but I'd be curious just to see kind of what kind of language they're using, how plain language it, just it might give us some other ideas also. Okay.
Okay, we are a little bit over time, so I am going to say thank you for all the input, and I'll come back to the next meeting with another draft and pass it over to you, Amy.
Thanks. So another thing that we talked about at last Thursday's board meeting was the idea of alternating board meeting locations potentially. So right now, if you come in person, they're always at the what's the name of the building? Bureau and Industry building?
Labor and Industry.
Labor and Industry building. Because we're housed at DCBS. But as one thought about getting public comment, potentially like alternating between Salem and other locations throughout the year, like maybe every other month. One consideration is because we have just had this major, or we're in the middle of a major staffing change, and the few staff that we have are, now staffing all 4 committees and the board, and have a lot to pick up until the new executive director is hired. This is something that maybe we start the discussion now, but don't actually start until spring. But we wanted to start kind of picking your brains about, what do you think about the board meetings traveling to different locations? Where would you recommend that the board travel for meetings? Like which communities, which cities? Who should the board seek to engage with in these regions or areas? And then what should the board consider when holding engagement sessions in terms of location, services, and materials if we're going into other communities? Mickey, I see your hand up.
I'm always telling people, come over here to Central Oregon. So come to Central Oregon, #1, and I can help coordinate and organize that for you. And because I'm in local government, I have a lot of connections with local government. We have a lot of folks who collaborate. We're big on collaboration here, so it'll be easy to convene a meeting with elected officials, with administrators of the county or the cities, the counties and the cities, tribal government. And then also we have a lot of community groups here, underserved and historically marginalized, BIPOC, you name it. So we're all working on collaborating and having a hub and spoke model here in Central Oregon as well. So I think it'll be easy to convene a lot of, I'm actually convening one now for sanctuary promise law with community group leaders here in Central Oregon. So convening that meeting. So convene one for that group. And then the next, so that's, the government, which is a large employer here in Central Oregon, the underserved, historically marginalized groups. And then the next is business community. So I would say we're really tight with we have a economic development of Central Oregon group, and they have a representative for each city and county. And so they could then rally some of the business owners, as well as Bend has a Chamber of Commerce, a really robust Chamber of Commerce. There's Visit Bend. So a lot of economic development and business community here as well, that when you do come join, I could see all of them being invited to the table. And they would be the source for, here's the people to invite, here's the employers to invite here in Central Oregon.
Yeah, and when you're talking, I was thinking about St. Charles is right there too, hospital system.
Yeah, and I've been working with St. Charles on a lot of different variety of different initiatives, efforts. They're always at the table. They're a really great partner.
Great.
And one of our biggest employers here.
Yes. Great suggestion. Do other people have ideas about where we should go when we go different places, who we should be engaging with. And just kind of the ideas to make the board and the work more accessible. I see Colin's hand up.
Yeah, I guess I have some ideas. A clarifying question, so the plan design committee is going to have a plan that we are able to speak to starting in June. There's a discussion about maybe every other board meeting being somewhere. The communications committee, I think we stop in March. So between June and March, that's about 10 months. So would that be a possibility of 5 in-person meetings somewhere in other spots of the state? Is that like about right, or more or less?
Yeah. Jenny, were you gonna say something?
I was just, I think, I mean, that's more or less, yeah. I don't know if the board will be able to do 5, but I would say, they're looking at the opportunity to do possibly 1 every other month. There's going to be some issues, probably depending on travel, like during the winter months, like I would say November to January, whether or not the board members would be able to travel during those months. But the goal is that the board would be able to travel, if not every other month, a cadence sort of like that. So I would say like they would at least do probably 3 to 5.
Cool.
And there would still be a virtual option for the public, and if a board member can't make it somewhere else that day.
Yeah. Yeah, my suggestions as far as places to go, I think Central Oregon makes a lot of sense yeah, okay, so if we have 3 to 5 possibilities, makes sense Central Oregon. Eastern Oregon, but based on, I live in Portland, right? But what little I know about Eastern Oregon often feels so left behind by the decisions that are made in the Willamette Valley, right? So Pendleton, huge city, or like, big city. Baker City, smaller. I think it'd be pretty smart to do this outreach at some of the different tribes, like they're welcome to join this plan, but they're not obligated. And I think having that kind of tangible physical outreach is a pretty strong statement about like where Oregon stands. So yeah.
Mickey, is your hand still up from before?
Yes, I have a follow-up. We actually just had hosted here in Bend the Western Governors Association, and it was like a 2-day workshop. And there was a senator in there that was like, I always hear about Portland, Salem, rural or urban, but what about the coastal range area, coastal area? So putting that in as well. And then he feels like, they're always seem to be left out. And then the other thing I'm wondering about is if we're going to do a board meeting, is there an opportunity to do like board meeting in the morning and then maybe the committees in the afternoon? So it's like a workshop with the community, as opposed to just like, hey, we're having a meeting, sit and listen, and maybe you'll have public comments and provide your public comments, but more like an interaction.
Yeah,
Amy, do you want me to speak a little bit
go
to
ahead.
that?
Yeah.
So the idea is that the board would do the traveling meetings and they would hold their board meeting in a different location in the state. And then after the board meeting, there would be other community engagement opportunities. So maybe meeting with the local chamber of commerce, maybe having a listening session with the local community. So more than just one engagement opportunity when they do these traveling meetings. The hope is to really have the meeting in another community and drum up people to actually come and sit in the meeting, but then also have other engagement ideas within that same travel opportunity. Yeah. And there was one other thing, the reason I raised my hand, I just wanted to let everyone know. So we have been in communication with the DCBS tribal liaison, because we've talked a little bit before about how we want to ensure that when we're communicating with the tribes, we're honoring the government to government relationship first. And so we've gotten some recommendations from our DCBS tribal liaison about a couple meetings we could go to start engaging with tribal leadership to get, first of all, their feedback and interest level in having us go out to engage with tribal members around the state. So first, making sure that we're honoring that government to government relationship and going to those individuals first and having those preliminary conversations before we start doing any sort of direct tribal member engagement. And so I just wanted to give you all an update on that. And I'll let you know when we have an opportunity for actual engagement with them, what that's going to look like.
Thanks, Jenny. So Craig, Grace, and then Juan Pablo, and then we probably need to move on if nobody does it. But you can always send us ideas after. Craig?
I'll be really brief. We're talking about the board, not this subcommittee, the board traveling, right? Okay. Number two, just real quick, I'm going to piggyback on what everyone else has said. They may have to do more than 5. You know, I agree with everything everyone said. We need to include the coast and Eastern Oregon, like you said, Central. That's 3 right there. And I would suggest, which is common sense,
Southern.
I-5 corridor, maybe Medford, Eugene, Salem, Portland. So that's right there 7, but I don't know if they want to travel that much. These are just suggestions. Thank you.
Thanks, Craig. And just a reminder, every board meeting currently is in Salem. And typically we have people who come in person from Corvallis, Portland, sometimes Eugene. But yeah, I think Southern Oregon is the other location that we haven't mentioned yet also. That's important. Grace and then Juan Pablo.
Hi, I have a suggestion. It's not necessarily a location, but just to convene around networks of folks who work in federally qualified health centers, so FQHCs. For example, even I know there's a lot of foot traffic in Portland, for example, but OHSU Richmond Clinic in particular has 3 culturally specific long-standing health equity groups. They meet on a standing basis, and so they have a good network of folks who meet there. And also I have another more niche suggestion to convene around reentry services for folks who just come out of incarceration and receive healthcare services. I think they'd be a good subset of folks to connect with, not just them, but amongst some of the groups who would be nice to meet with. So those are my suggestions. Thank you.
Thanks, Grace. Your FQHC suggestion reminded me about reaching out to Oregon Primary Care Association, the group that the FQHCs all belong to. Juan Pablo.
Hola, buenas tardes. Tenía un comentario que quería hacer. Primero que todo, quería saludarles y disculparme por haber llegado un poco tarde al meeting de hoy. Con respecto al comentario que tenía, creo que visitar las zonas rurales va a tener un gran impacto en cómo este comité se va a reflejar en la comunidad. Sé que otros comités están visitando esas zonas porque están viendo que es un buen inicio para restaurar las relaciones con agencias tribales, con organizaciones sin fines de lucro, con la comunidad. Así que considero que salir un poco del área metropolitana y de Ceylan a zonas que nos pueden traer un gran feedback e incluir a la población minoritaria. Porque en la búsqueda de equidad, eso se basa en toda la ecuación, no solamente desde el punto de vista que lo estamos viendo. Equidad sería visitar zonas que jamás se han visitado. Sería equidad en el sistema de salud. Y creo que es lo que este comité está buscando. Pero entiendo que la movilidad, el acceso puede ser una dificultad. Pero creo que es algo que deberíamos poner en la mesa de poder visitar zonas que realmente no tienen una gran participación, no tienen una voz. Pero quiero conocer también qué piensan los miembros. Gracias.
Great. Thank you, Juan Pablo. I think we're due for a break next. So if you guys have other ideas about that whole traveling board engagement piece, please send staff your ideas and thoughts. Oh, Jensina. Sorry, I didn't see your hand.
Hi, That's okay. Do we have a translator for Juan Pablo, or is there a way in the transcription to
Oh,
have it
so
translated? I would love to know what he said.
yes, so everybody, I think you might have come on after the instruction. The
Oh,
globe,
okay. Sorry.
yeah, so if everybody, when they come into a meeting with interpretation, where the globe is, you set it to this language that you speak and want to hear through. So
Okay. Thank you.
yeah.
All right, so it's 2:12. That was a great discussion. Thanks y'all for all of your feedback and input in today's meeting. Really appreciate it. We'll come back at 2:22 and continue with our agenda. Welcome folks back. If you could, as you come back, turn on your camera or give a thumbs up and let us know that you are back, and we'll get started again. Hope everyone took a stretch or got a snack or took a deep breath, whatever you needed to do. And I'm going to turn it over to Jenny to talk about our resource list and form. Thanks, Jenny.
Thanks, Michelle. So I'm going to make this very, very quick. It's just a little bit of an update to show you all some automation that I've added to our sheet so that we can move on to the committee updates since we're a little bit behind. But so what I've done is I have moved our resource list that we've been compiling as a group over to Smartsheets and created a form for that resource list. The link to that form is going to go out to all of the committee members. And essentially what it does is it gives you the opportunity anytime you'd like to add something to the resource list. It gives all of the fields that we have been looking at in the spreadsheet that we've been keeping. And this sort of automates it and then feeds it into a smart sheet that's like an Excel sheet that just holds all of that information for us, so that as we start to look at our community engagement and some of the groups that we might want to engage with when we're traveling, or if we're pushing out information at some point, this is going to be a great resource for us to use in both those travel meetings and in looking at distribution lists. And so, like I said, you'll get an email that provides a link to this form. You can fill out the form anytime there's anyone you want to add to the list. And Katie, you go to the next slide. This is just a snapshot of what it looks like on the internal side of what is being propagated in that list. So the organization is captured, the community focus is captured, the city and region, there's some work to be done there because in the initial putting the information in, we didn't always include that. And so I've been going through and trying to do that. And then website, and then there's a couple other fields that are optional. All the fields actually are optional, so that you can put in notes if you want to, or information if you want to. But this just provides a little bit of automation so that it's not just an Excel document that's sitting somewhere. This way, the whole committee can interact with it and provide information anytime there's anyone you want to share. I do want to say, if you're more comfortable or if it works better for you, you can always continue to send any contacts to me to add to the form. That's absolutely okay. You don't have to engage with the form. This is just another way to add that info. John.
Oh, just two quick things. I can't see the slides. I don't know if it's just me in my view, but and then also I was just going to ask Jennifer, will we be able to, in addition to the form, which sounds really helpful, will we be able to actually get a view of the whole smart sheet too? Okay, I just wanted to make sure.
Yes. And is anyone else having any trouble looking or seeing the screen or seeing the slides that are being shown? No? Okay, good. But John, not great for you. And
I wondered,
troubleshoot. Grace, did you say you are? Or you just
no, I'm not experiencing that, but John, if you just look at the top of the meeting bar, there's going to be two screens. One says meeting and then one says Katie's screen. And so you just have to click the one on the right.
Thank you.
Yep. Thank you, Grace. Okay, and if there's no other questions or comments, we can move on and we'll get right back on schedule. Perfect.
Thanks, Jenny. All right, so that brings us to a new agenda item, which is committee member updates. This is going to be a standing agenda item moving forward. And it's just an opportunity for you to provide an update on any engagement activities or opportunities that you've participated in or that are coming up that you want to make sure the committee is aware of. And so it's optional. You can share as much or as little as you want, but as you all know, this is a really well-resourced, excited, action-oriented committee. So we'd love to hear about any engagement opportunities that you're involved in or aware of, or that might be coming up. So I will turn it over to all of you. You can just raise your hand if you have an update you want to share. Jensina, and then Colin. Sorry, Jensina, you're muted.
Let's try that. Can you hear me now?
Perfect.
Okay, thanks. I double muted myself. I'm special like that. So I live in Eugene, and in Eugene, the Eugene Healthcare Coalition is working on putting together the second citywide healthcare forum. Last September, I'm the vice chair of Churchill Area Neighbors, and last September, Churchill Area Neighbors hosted the first citywide healthcare forum. And we had about 200 in attendance, another 200 views online. Now the online views on the YouTube recording have gotten up to 700. So this time we're actually shooting for 500 in the audience, and hopefully as much YouTube and media coverage as we had before. On our panel, we have Senator James Manning, Representative Lisa Fregula. We have a representative from Healthcare for All Oregon. Amy Fellows has agreed to be one of our panelists as well to provide an update on the Universal Health Plan and Governance Board. And so this will be a 2-hour event on March 1st in the afternoon. Actually, the NAACP is doing a health fair for a couple of hours before the forum. So we'll have probably about 25 to 30 different organizations tabling in the lobby and providing more resources to the community. And then we'll go into the main auditorium for the forum. And it will be a panel of 7 elected and appointed officials who can talk about the state of healthcare in our community, what's being done at the legislative level to improve access to healthcare, and then particularly regarding coverage, financial coverage for the medical services that we all need to receive.
That's awesome. I wonder, Amy, do we have that we can send out to the committee, the details?
Yeah, I don't know if I have it. Yes, the flyer hasn't changed since you gave it to me last week, right, Jensina? The little.
That's always a great question, Amy. I'll send it to you again just in case there's a newer version.
Okay, all right, and then we can
Thanks.
share it out.
Okay,
Thanks.
that's awesome. Thanks so much, Jensina, for all that work and for letting us know. That's really exciting. And thanks, Amy, for being willing to be on that panel. Go ahead, Colin. And then just a quick note, I see another hand, but I don't believe that that is one of our committee members. So just a reminder that folks from the public are welcome to view the meeting, but the only opportunity to participate is public comment. So that doesn't mean we don't want to hear from you. If you do have an engagement opportunity that you know of that's coming up and you don't want to submit public comment, you can email it to the committee, and I'll get that. I'll actually, Jenny, do you have that email address off the top of your head?
I do. It is uhpgb.info@dcbs.oregon.gov.
Thank you, Katie. So please email any engagement opportunities there. And sorry about that limitation in our meeting. Go ahead, Colin.
Yeah, I'm glad to share about I organized 2 in-person events in Eastern Oregon earlier this month, just about 2 weeks ago. Kind of was, I haven't said this exact phrase to Amy and Michelle, but in our last community engagement meeting where we talked about a communications contractor, but we didn't really set a timeline or dive too deep into that discussion. That was one of the reasons why I wanted to try to do some outreach and also just to sort of see how it would go. Yeah, so I can give an update on those 2 events. They were my events, right? So I tried to make it pretty clear per one conversation with Michelle, where Michelle, you said I could really say whatever I want as long as I'm just crystal clear that I'm not representing anybody but myself, right? And so, and I and a couple other people on this call have either current connections with Healthcare for All Oregon or former, relationships with Healthcare for All Oregon. And so, even at the beginning of my meeting, I made it clear that I wasn't representing the nonprofit that I work with, nor was I representing the governance board. But yeah, so did 2 events. I was reached out to the Baker Bite, which is like a little Baker City news thing. I think they published it on January 7th, and I spoke on the 9th at the Churchill School. So like there was a little bit of outreach. Yeah, so I followed up. I listed some of the key points, which I guess I'll go through right now. So I didn't take attendance, but in each town, I went to Baker City and I went to Enterprise, and there were about 15 people that showed up from, I didn't, do a demographic survey, but just from what I could see, most people were sort of still, even though I traveled across the state, they were still sort of within my bubble. Like most people were white or white passing. Everybody spoke English. There were a few people of color, but there were no people that were opposed to the idea. So it was publicly advertised and did some emails in both of those locations. It wasn't in like any of the big papers, so it wasn't in Elkhorn Media, which is a suggestion I can get to. But yeah, so most people were retired, but not everybody. It was a last minute thing. Like I threw those two events together in a month, but still something happened, right? 15, 30 people total showed up to those events. As far as something that I found really kind of heartening, or I don't know if that's a real word, really inspiring and helpful, was that the librarians in these towns were like instrumental in getting it going, right? So the library director in Baker County pointed me to the exact right people who could host an event and recommended a lot of outreach. And the same thing happened in Wallowa County with that library director. So that was pretty cool. I think we're all here because we like talking about this topic. And so it was really nice to be able to share the facts of what I understand and what I know, along with my own personal opinion about politics and why, my personal story about why healthcare is important. So that was pretty cool. I liked having it. I called the event a Universal Healthcare Community Conversation, which I think is a phrase that we're going to go forward with Healthcare for All Oregon. But we haven't exactly formulated that kind of community conversation, but the intention with our organization is also to do different kinds of outreach. And so that may be the title of it, but to sort of encourage it as a conversation, I asked people to interrupt or ask questions like right off the bat. And yeah, in Baker City, they were really dynamic and sort of we talked the entire presentation. In Enterprise, there was more questions at the end, but having that setting the tone that it's a conversation was really cool. The action that I proposed at the end of this event was to either get involved with Healthcare for All Oregon or submit the comments to the board. I did not follow up with those individuals to see if they took either of those actions, but they're aware of them. And I asked questions at the end, which were, how should we talk about this to your community, like the rural community? And I was sort of implied the people that were not in the room, like maybe more conservative folks. And so, yeah, how phrases to say to talk about it, and also different areas or different ways to do that physical outreach, like if a certain newspaper or billboard or whatever were part of that conversation. So it was awesome. You guys have questions about it? Oh, and I have, before I hear your questions or whatever, one thing that I think would be great, it may be organized informally with Healthcare for All Oregon or individuals or something, would be to have other committee members from other committees available at that kind of event. So if there was, I think an amazing event could be an informal conversation with somebody from the finance committee, plan design, operations, communications, ready to give our take. And so funny to bring up in this context, how do we informally organize? How do we formally, informally organize something like that? So, or how does HCAO? Thanks.
Wow, thanks, Colin. I heard some really great tips in there, and I appreciate you doing that work and also sharing it back with us. It's great to hear. And I know you're asking for if anyone has questions. When you asked that, I saw John's hand go up. John, were you gonna ask a question of Colin?
Yes, please. Yeah, so just a quick question, Colin. You mentioned there at the end that you posed the question to the participants, how do we talk about this to your community, and how do we do the outreach in your community? What, in a nutshell, what did you learn from that?
Yeah, in a nutshell, the ideas of speaking to personal freedom and choice were what people thought would be important. And then as far as places to do the outreach, the one that was most consistently like brought forward were like the any sort of city government or county government. Facebook, I guess, is how a lot of that organizing and communication is done in some of those smaller communities. And then Elkhorn Media and the Eastern Oregonian was suggested as like the main newspaper to do outreach. There was a phrase that was, I think, possible to hear in that kind of informal context, which was like the idea of undoing Obamacare. Somebody suggested as a interesting way to get people's attention. I don't know how accurate that actually is, but yeah.
Thanks for those insights and thanks for that question, John. Juan Pablo, I see your hand. I just want to see if anyone else has questions for Colin, and then we'll go to you. Any other questions for Colin? Go ahead, Jocelyn.
Do you have like your presentation or notes on it that you could share? I think it'd be cool to see those.
I'm open to sharing them. It is pretty, it's a personal slideshow, right? So it's not, yeah. But I'm down to share, and we could share outside of this formal context, or I don't know how to answer that question. Yes, I do.
Okay, yeah, I just was curious what you'd presented on, but
Sure.
yeah,
Yeah.
up to you.
And I think Michelle alluded to this earlier, but after every board meeting, we have kind of board talking points, kind of like where we are in the process. And we shared those with Colin before he did these so that, you know, the talking points were kind of in line with what's happening with our work. So that's something that we can do. Like before the March event, I plan to, you know, make sure that I have that when I'm on that panel in Eugene here.
Thanks, Amy. Any other questions for Colin? And Jocelyn, is your hand up again or still? Okay, great. Go ahead, Juan Pablo. Sorry, Juan Pablo, you're muted. And also just a quick note before you start. I'm so sorry, Juan Pablo. We found out that for folks who are joining through phone audio, the translation option is not available. So we apologize for that. But if you are connected through any computer, you can click on the translation. It's like a globe icon. And if you're an English speaker, click English and you'll hear the translation from Juan Pablo's words. So thank you. Go ahead.
Hola nuevamente, no sé si Bobby tenía una pregunta, había alzado su mano antes que yo, no sé si quería comentar algo del comentario pasado.
Thank you so much, Juan Pablo. Bobby is not a member of the committee and so is not is
my
only able
fault.
to listen.
Ok. Ok, primero quería compartir con todos ustedes una iniciativa de la cual soy parte. Esta iniciativa busca llevar educación culturalmente específica a áreas rurales y tribales. Ok, esta es un proyecto piloto que busca proveer educación gratuita y culturalmente específica de doble inmersión. ¿Qué quiere decir esto? Que los estudiantes pueden ver una clase presencial, pero también manejan un libro y es una educación autoguiada. Esto ayuda a que la educación culturalmente específica sea más sencilla de comprender. Yo soy uno de los facilitadores de este proyecto piloto. Recibimos un financiamiento por parte de Gobi en el área rural. Nuestra misión es poder en los próximos 3 años otorgar 2 millones de CEUs totalmente gratuitos. Este fin de semana tenemos nuestro primer entrenamiento, training. Durará unas 8 horas donde se entregarán CEUs para consejeros, mentores, promotores, dulas, totalmente gratuito. Además de eso, los estudiantes que participen tendrán un extipendio, cosa que es una gran iniciativa para que la gente entre educativamente y se forme. Creemos que un sistema de salud sano tiene que estar compuesto por profesionales educados, profesionales y siguiendo normativas éticas. En este el primer entrenamiento tuvimos la máxima capacidad de asistencia y me gustaría traer en el futuro más notificaciones del trabajo que estamos haciendo de manera rural para llevar a profesionales mayor educación, ir a zonas desasistidas, llevar un granito de arena en pro de la inclusión y equidad de una comunidad que representa una gran parte de trabajadores de salud y quería compartir esto con todos ustedes. Gracias.
Thank you so much, Juan Pablo. Appreciate that update, and it's such important work. There's so much conversation in Oregon and at the legislature right now about the need to diversify Oregon's healthcare workforce, and but there's not very many people doing that in a way that is culturally specific and accessible. So that's great work. If those networks are folks that you are in touch with, that you think would be interested in giving input once we start doing community engagement, that would be amazing. So looking forward to staying in touch with you about that. This is an amazing group, y'all. Thanks so much for your work and for these updates. Any other updates from committee members? All right. Well, so much gratitude. Like I said, this will be an agenda item every month. So, if there are future engagement opportunities or things you're involved in, we definitely want to hear about them at future meetings. Amy, were you going to say something?
Oh no, I
I'm
was just
passing.
getting ready for the next item, which is as we wrap up here, committee member reflections for today and future topic ideas. I think we did capture a few future topics. One of them was to bring you back a visual for our community engagement timeline. Public comment instruction updates, having a draft of what Jenny showed you today and kind of the next iteration of that. Jenny's going to work on a tips document that we'll share with you, and then we will try to arrange for a strategic communication panel like we talked about from the two folks that were involved in the Healthcare for All Oregon panel last June. And then if people have ideas for other folks, please let us know. And then just want to hear from you all if you have any other thoughts on future topics or reflections on today's meeting. Yes, Jenny.
This isn't necessarily in line with that, but I did want to share something. Amy had mentioned that we shared the governance board talking points with Colin before he did his engagement. Those documents are going to be available to everyone on our website in just a couple days. And then it's something that will be posted monthly after the board meeting, any updates to what the board discussed during their board meeting. So there's always going to be talking points and a PowerPoint presentation that goes along with them. The PowerPoint presentation will be posted as a PDF, but you can reach out and we're happy to provide the actual PowerPoint to you. So any engagement that you all want to do, if you want to keep those talking points with you, like Amy was saying, or you want to reference those are going to be routinely available on the website to you. So we'll share what the web page link will be for that specifically, so that you all have access to that continuously and you don't have to request it.
Thanks. Looks like maybe nobody has further reflections. We had a lot of great dialogue today, and I think we definitely have a list of things for our next meeting. So what's the next agenda item? And we have no public comment today, is that right? Okay, so I think that's the end of our meeting today. We're giving you back 14 minutes of your life. If nobody has any final last words.
Thanks so much, everyone. Great to see you. Take care.
Thank you.